So we spoke about some of the basic things about H1N1. Let's talk a little bit now about the vaccine. So how and where would I get it?
Okay, so the first thing you're going to do is you're going to call your CF doctor or your primary doctor or pediatrician. So those are the two resources. Your CF center may have already, had some conversations with you or sent out a letter like we did or a phone call about when to anticipate that the vaccine would be available. So they're your first resource. The next place to look is the schools. The schools, certainly for school-age children, they were giving out free vaccines, in all the various elementary schools, certainly and locally in New York City. So that's a resource to you. They may have extra vaccine, and they may require a prescription from your doctor. The next place also would be Department of Health would know about it. You could call your local Department of Health. There's local pharmacies that were also giving them out. So that's a lot of resources to find out where to get the vaccine.
Okay. And what about, do you recommend that everybody with cystic fibrosis get the vaccine? Because I know there's a lot of people out there without CF, but they're saying, well, they're not going to get the vaccine, it's too new. But do you recommend everybody get it?
I recommend everybody get it. I definitely appreciate that people are concerned that it's new. It's new in terms of the virus. The technology is not new. The way they're making the vaccine is the exact same way we make the seasonal vaccine. And again, had they not already started making the vaccine, it would have been included. But so I understand it, but I definitely recommend that they get the vaccine. And we haven't seen any kinds of complications from the vaccine itself. It's been very well tolerated, the IM injection and immediately afterwards.
So there's not many side effects other than what's expected from like the regular flu shot?
Yeah, I mean, our patient population should only get the intramuscular injection. They should not get the nasal version of the vaccine because that's a live virus, so we don't recommend that to our patient population. And so usually like with the flu vaccine, you get soreness, and the patients haven't even complained of that. And then you may get some feeling of feeling like under the weather, a little sore throat, and patients haven't really even complained about that. It's been very mild.
And how effective is the vaccine? Has it been pretty effective so far from what you've seen?
The data, we're collecting the data as we go through this season, but it looks like it's fairly effective anecdotally. But, we are still learning about the vaccine.
So to be clear, your recommendation is that everybody with cystic fibrosis should not get the nasal vaccine?
Yes, that is the recommendation, as well as we don't recommend that people in the household get it. The nasal vaccine, you'll be shedding live virus, so the recommendation is no one in the household as well.
Speaking more about cystic fibrosis and some of the bacterias that we deal with CF, if you've colonized MRSA or some other microbacteria, would the H1N1 vaccine exacerbate the infection?
Any viral illness can exacerbate the lung disease in CF, and H1N1 is not any different, except H1N1 patients tend to be a little sicker, and so the patients who do have MRSA or other difficult to treat organisms, those patients definitely may require changes in their antibiotics. Patients with more lung disease whose lung function is lower, or patients who are generally just sicker, those patients definitely may require more care.
Is it just one vaccine, or should you get another one in 3 months or in the spring? What's the data on that? Is there any?
So the dose of the vaccine changes with your age. The recommendation is that up to 9 you should get 2 doses of the vaccine, and essentially 9 and above you can just get 1 dose. The doses should be about a month apart. Come spring, if you're vaccinated now in October, will you have coverage in May? Unlikely that the antibody titer would last that long. So if we reach another spring increase in cases of H1N1, we're going to need to think about revaccination. And the infectious disease people, the Center for Disease Control, will definitely make recommendations.
Okay, now if I have a child, which I don't, they get the vaccine, and we spoke about, I think for children they should get two vaccines. How long do you wait before you get the second vaccine?
You should wait about 4 weeks. You don't want to cut it too short, and you certainly, don't want to wait too long, but somewhere right in the range of about 4 weeks is the best time frame.
If my child gets the first shot, and we said they need to get two shots, how immune are they to the virus after the first shot?
After the first shot, typical for anyone who gets the vaccine, but particularly children, it takes about 2 weeks to develop a decent antibody response. So you are not considered really immune within the first week or so after the vaccine. And secondly, you definitely need the second shot at 4 weeks later to really develop full immunity.
How dangerous is the thimerosal?
So there's a lot of concern about the thimerosal, which is basically mercury. And that comes from basically in pediatrics, we give mercury-free vaccines. The current H1N1 vaccines do have a very small amount of mercury in them. There are mercury-free vaccines available, particularly for young children, and certainly under the age of 2 years, we recommend that they get the mercury-free. There's associations between mercury and brain development issues and just mercury toxicity. So that's where all the concern comes from. There's very little in the vaccine. It should be used for older children and adults. And if you're definitely under 2, you definitely want to try to get the mercury-free vaccine, which most children's hospitals will have access to.
Okay, so as you're quite aware, people with CF, they have a lot of therapies that they have to do, a lot of pills, a lot of doctor appointments. So now we're talking about more vaccines. So we have the typical seasonal flu, we have the pneumonia vaccine, and we also have H1N1. Is it possible to get them all taken together, or do we need to space them out for different appointments?
So the short answer is yes, you can take the vaccines all at the same time. Obviously, would be different sites for the injections. But you do want to have a conversation with your CF doctor if you're one of these individuals who maybe should consider spacing them out. And that has to do with your own individual constitution and how well or ill you are at the moment that you're going to the CF center. We have some patients that are not really good about coming in for their regular appointments, so if we sometimes will, yes, vaccinate them all at once because we know that we may not see them for a few months or 6 months. So, that's also an issue in that decision-making process.
Okay, I'd like to talk a little bit about nursing and getting the shot because we talked about the thimerosal. Is nursing a problem if you have the shot because of the mercury involvement or that's in the thimerosal?
So the recommendation for breastfeeding moms is to try to get the mercury-free vaccine. If they cannot get the mercury-free vaccine at all, they really have exhausted their resources, then getting the mercury-containing vaccine is certainly reasonable. It's better than getting the actual illness if you're nursing. Because then you're not going to be able to nurse. And there's very little mercury in the vaccine and very little passes in breast milk. So, a lot of the risk is more theoretical than actual. And so it's, again, if I don't get the vaccine, how sick am I going to get? And weighing that risk against how much mercury would actually come out in the breast milk.